Good afternoon. Thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe and Saskatchewan's Chief Medical Health Officer, Dr. Saqib Shahab. As well, joining us on the line is the CEO of the Saskatchewan Health Authority, Scott Livingstone. Both Premier Moe and Dr. Shahab will have some remarks, and we will have time for questions.
Thank you very much. Good afternoon, everyone, and thank you for joining us here today. Today we are reporting 14 additional deaths related to COVID-19, and this is unfortunately a sad reminder that this is a dangerous and very deadly disease that we are dealing with, and that we all need to follow all of the public health orders and guidelines to keep ourselves and keep those around us safe. I want to express our deepest condolences to the family and to the friends of each of these individuals. The number of new cases in Saskatchewan continues to gradually decline. Today we are reporting 232 new cases, and our 7-day average of new cases is now 254. That's down about 20% from its peak of 321 on January the 12th. Active cases are now down to 2,665, and that is the lowest level since November the 21st, and now down over 40% from our peak of 4,763 on December the 7th. This gradual decline means that our current public health orders that are in place and the restrictions that we have are working, but we need to leave them in place for a while longer. Therefore, all of the current public health orders that are being extended for an additional 3 weeks until February the 19th. These include private indoor gatherings will remain limited to immediate household members only, with some limited exceptions for those individuals that may be living alone, for caregivers, as well as for support services. Private outdoor gatherings can be up to 10 people, provided physical distancing can be maintained. Most retail locations and personal services are reduced to 50% of their capacity, and large retail locations are further reduced to 25% of their capacity. Restaurants are limited to 4 customers per table and 3 meters between tables for in-person dining, and places of worship, concert venues, and theaters are limited to a maximum of 30 people. And I ask everyone to continue following the public health orders and the guidelines to keep yourself and those around you safe. These measures are working when we follow them, as the vast majority of Saskatchewan people and businesses are doing. There have been a small number of mainly bars and restaurants who may not have been following those, putting their staff, putting their customers, and essentially putting their communities at risk. So I have asked that we increase enforcement on those who choose to break the rules. And in recent days, there's been 3 significant tickets with significant fines that have been issued to bars in Saskatoon and Regina. Some other investigations are ongoing, and they may result in additional fines. Of course, as we've always said, issuing fines and penalties are the last resort, but they are necessary at this point. What we really need and what we really desire is compliance, for everyone to follow all of the public health orders and the guidelines that are in place. That is how we will continue to reduce our case numbers, so that hopefully in 3 weeks from now, we can start to maybe look at easing some of the restrictions that are in place. Of course, the way we will truly get things back to normal in this province, across the nation, and around the world is through mass access to vaccinations. We made a lot of progress in our vaccination program over the past few weeks, but we continue to be limited by the slow pace of vaccine deliveries to and from the federal government. Saskatchewan now has the highest percentage of vaccines administered, and we have the second highest per capita rate of vaccinations completed among any of the provinces. Unfortunately, today we are virtually out of vaccines. And with no new shipments coming this week, our vaccination program will be stalled for the next number of days. Next week, we are expecting receipt of over 12,000 additional vaccine doses. Just under 6,000 or 5,850 of those will be Pfizer doses, and they will be distributed to Saskatoon, Regina, North Battleford, Yorkton, and Swift Current. This will allow us to continue vaccinating our long-term care residents and staff and others that are over 70 years of age. There will be 6,500 Moderna doses that will be sent to the far northwest, the far northeast, the northeast regions of the province to provide second shots for people that have already received their first vaccination dose. And it will also be provided to the central west region to start administering first shots. Our healthcare workers will continue to administer thousands of shots a day throughout the province, just as quickly as those vaccines are delivered to our province by the federal government. We'll continue to press the federal government to do everything that they can to deliver more vaccines to Saskatchewan communities more quickly. And to also to look to approving additional types of COVID vaccines for use here in Canada. In the meantime, I would ask once again, please keep following all of the public health orders and guidelines that are in place. They work. And that is how we will reduce the spread of COVID-19 until we are able to get most of our population vaccinated and that life can actually return to some degree of normal. Thank you so much for everything that you've done. Dr. Shahab.
Thank you, Premier. So, first of all, I'll also start by offering my condolences to those who have passed away since last time we spoke. Unfortunately, we have lost 46 additional friends, family members in Saskatchewan, and as well as 14 additional deaths reported today alone. And this really drives home the point that the Premier is making, why we all have to really continue to observe all the public health measures that we are following. Hospitalizations and deaths usually result as a result of illnesses that present 2 to 4 weeks earlier. So we really look forward to seeing a decrease in our hospitalization deaths in the coming weeks. And I think it's really important that we are seeing a steady decline in our case numbers. All the indicators are moving in the right direction. It's slow and it's steady. Our daily case numbers have come down from 24 per 100,000 to 20. Active case numbers daily have come down to 329, 266. It's slow, but it's in the right direction. Test positivity is under 10%. And it's coming down throughout the province. And I think that's really important. It's still too high, unfortunately, in terms of the numbers of hospitalized and deaths that it's leading to. And as the Premier said, the vaccination is important, it's critical, but the supply is of a nature that it will be slow and steady for the next few weeks, and it will start picking up March, April, and then we hope to see significant impact in hospitalization and deaths. But till such time that we start seeing a higher uptake in those most at risk, we really have to stay the course. The other thing is that, with our public health measures, some people say it's too little, some people say it's too much. But, they do try to strike a fine balance between minimizing cases as long as the guidelines are followed and letting people work, enjoy other amenities as much as possible. Obviously, it does impact some people more than others in terms of what their interests are. But the downward trend does show that if all of us abide by public health principles, it has a significant impact on our case numbers. And while obviously making measures more stringent would always be an option, unfortunately, if our case numbers went up, that has to be balanced against the economic, mental health, social costs of strict measures. And if we can stay the course with our current measures for another 3 weeks, continue to see a downward trend, I think that would really be a very positive outcome. And then we can reassess, middle of February, what should be the plan for the future. It's like the Premier said, I have daily discussions with medical health officer colleagues throughout the province. They're saying that, obviously we can't prevent every case of COVID, but whenever people are following the Reopen Saskatchewan guidelines, whether it's in a restaurant, whether it's in a workplace, there's very little transmission. But in most cases, they are saying, that people were compelled to go to a place of worship, to a funeral or a wake while they were unwell, but they felt compelled to go because they had lost a loved one. People at work, at break times, before and after work, socializing, getting closer than 2 meters, sharing food and drink, whether standing outside or in break rooms, that's generating transmission. And again, it's those small, simple things that when we let our guard down, COVID does come. It results in a local cluster at work or in a social setting. It impacts several households, which then impacts several schools and other workplaces. And I think that's how outbreaks happen and snowball. We've seen that in Saskatoon. We've seen that in the north. Secondly, of course, if you live in a setting where there's crowding in the household, you can't safely isolate as a case. Public health and social services are there to support you, to accommodate you, and alternative accommodations for the 10 days that most people require to safely isolate. And that can have a significant impact in reducing secondary household transmission. Many can safely isolate at home, use their own room and washroom separate from the rest of the family, and that can result in very little risk of secondary transmission to other family members. But if that's difficult to do, public health and social services can help with arranging alternate isolation arrangements. So, I think it is important really to continue doing the basics. Stay home if you're sick, essential, wearing a mask, following, all the other guidelines around safe distance, hand washing when you're out and about or at work. Like the Premier said, where there's clear lack of compliance with reopen Saskatchewan guidelines or public health orders, unfortunately, enforcement is required. But that really should be the last resort. I think all of us should know the guidelines. We should, as business owners, as people who run other, social events, as individuals and families, we should all consult those guidelines regularly, see what the updates are, and fully comply with them. It's not just up to a business owner in a restaurant that compliance is sought. As a customer visiting a retail location, a restaurant or bar, it's up to all of us to comply. And I think when we don't comply, we put our friends, family, the business, and the community at risk. So finally, I'll just say that, I think this has been a good week in terms of downward trends. A terrible week, of course, losing friends and family, and many notable people, personalities, Mr. Woods, others have passed away. And, we have to realize that while the risk is highest in the elderly, COVID takes people in every age category, and we really can't let our guard down. It is a lethal disease. In every age category, the risk is highest if you're older than 60, but we have had deaths in people in their 40s, in their 20s, 30s, 50s, and we really need to take care while the vaccine rolls out, and these measures can keep us safe, keep our families safe. Thank you.
Thank you, Premier. Thank you, Doctor. We will now take questions, and we'll start on the line. Operator?
We have Murray Mandrick with the Leader Post.
Good afternoon, sir. I guess question that we're wondering about, given Manitoba's decision to impose more restrictions, is why we're not going that route. Our positivity rate still remains frustratingly high. It's going to be very difficult to enforce the Manitoba rules in places elsewhere, and one would think that the provinces would be moving in unison on this. Was there any thought considering to having similar travel bans there and similar quarantines ideas? And if not, why aren't we, given the percentage of active cases compared to other provinces, given the way how other provinces seem to be doing better than we are?
Yeah, so thanks, Marian. I think you're referring to the 14-day quarantine that Manitoba has for people entering Manitoba. So we know that the Atlantic bubble has tried to maintain a very low COVID infection rate throughout, and it's good for them. Obviously, we in Western Canada have thought about these things, but we have found, in consultation with our colleagues, that throughout Saskatchewan, two long borders with Manitoba and Alberta, many border communities where people go to work or shop, it was not thought practical. Obviously, we will continue to look at all options, but at the moment, it is not practical. Obviously, we do say that, we do recommend that you minimize travel within the province and to other provinces, and obviously, international travel is not recommended. It's very uncertain around international travel. You require tests to come home. There may be other restrictions that we put in place. But having said that, I think at this point, we'll certainly look at, explore what Manitoba's decision was further. But at this point, The safest measures are what we are doing at the moment, staying close to home, avoiding non-essential travel. But many people do have to travel for work or for other essential reasons. But again, they still have to follow all the guidelines here or in the province where they're going. And beyond the guidelines, practice what we practice all the time: mask use, hand hygiene, physical distancing. And if you become unwell anywhere in the province or anywhere while traveling, you have to isolate, get tested, and seek public health advice.
Follow-up?
Separate question. In light of the stupidity on the weekend in front of Dr. Shahab's house, Mr. Premier, is there a need to more clearly state to the public that it's not Dr. Shahab making these decisions, that this is the decision of you, this is the decision of government? And also in light of that, is there more need for occupational health and safety regulations, any kind of changes under the Public Health Act to protect public servants like Dr. Shahab from harassment?
Well, yeah, let me just say a few things with respect to that. And first and foremost, maybe just a personal statement. Over the course of the last 10 months, I've had the opportunity to work quite closely with Dr. Shahab, and I would just say that I greatly appreciate personally the effort and the way that he approaches his job each and every day, and the way that he approaches people each and every day. And I would say that Saskatchewan, what happened this weekend is not what Saskatchewan is about. And I would say that Dr. Shahab, that Saskatchewan is a much better place with Dr. Shahab here doing what he does each and every day. Saskatchewan is a much better place with Dr. Shahab's family here doing what they do, contributing to this province each and every day. What we saw this past weekend was there's a line that was crossed, whether it's a legal line or whether it's just a line of where we are as a society in this province, and where Saskatchewan people his head is at. We most certainly, I think, and the vast majority will agree that line was crossed. There is a place and a time to respectfully protest decisions that are made by the government, and the decisions that are being made are made by the government. They're made most certainly on the advice of Dr. Shahab. They're passed and put into action under Dr. Shahab's signature, but they are decisions that are made by the government of Saskatchewan with the very capable and competent advice that is provided to us by Dr. Shahab. There is a place to protest these decisions. We see protests in front of this public building frequently. Throughout my time being an elected person, and by, I would say, the vast majority of those protests are done in a very respectful manner, and I'd say they're done quite effectively, as the government does take note when there is a protest outside of this public institution. Those protests are protesting a government decision. What we saw this weekend was a protest that moved from protesting a government decision to protesting a person. That isn't us in this province, and it needs to stop. There is opportunities for this government to look at, I don't know whether it's under occupational health or what, where exactly we will be looking, but we are looking at, is there now precipitous for us to ensure that when protests are taking place, is there a way for us to ensure that they are happening and they are focused on protesting the decisions that are being made, and not moving to people's personal residences and protesting the people that are involved in making those decisions. That is not the Saskatchewan way.
We'll take our next question in the room. Colton?
With the outbreak at extended care in Saskatoon, is the SHA planning on taking over daily operations, kind of similar to what they did in Regina?
Is it Scott on the phone? Scott, I would just say that the SHA is, in constant contact with many, if not all, on a very frequent basis of our private long-term care providers, including extended care, Preston, I believe, in Saskatoon. And they're working very closely with them, given the outbreak that they have there. But Scott, do you have some more details with respect to extended care, on Preston and Saskatoon?
I do. So as you all know, Preston Extended Care is in an outbreak situation. The Saskatchewan Health Authority has been working closely with local leadership on extended care and working to manage the situation. We have not entered into a co-management agreement with Preston Extended Care in Saskatoon, but we do remain in daily contact with their leaders and are supporting the situation. We've had our local teams are given daily updates on what's happening, and we've been in the facility both doing safety reviews and supporting their use of PPE, as well as some small equipment that they need. We're loaning it to them now, and they're purchasing it. But we are doing safety reviews, which ensure appropriate outbreak management standards are in place. The facility is fully staffed, which is different than some of the other situations we've seen. And we are on, as I said, on an ongoing working with them and getting full cooperation from the extended care leadership team on the ground, as well as nationally.
Follow up?
Scott again, but is anything changing at Yorkton Hospital with the outbreak there?
Scott, do you know anything about the Yorkton facility?
Yep. So, Colton, are you referring to the COVID status of the facility or the ongoing outbreak? So it's an ongoing outbreak. We continue to monitor and put in all those practices we do when we have COVID positivity at that level within a facility. I don't have anything to add other than what we've been reporting daily, and we continue to monitor the situation, work with the teams and staff on a daily basis.
We'll take our next question on the line. Operator?
We have Kyle Benning with Global.
Good afternoon. This question is for both Dr. Shahab and the Premier. I want to start off by saying I'm sorry for what Dr. Shahab and his family is going through right now, considering the protest outside of his family home. With multiple protests taking place, mentioning Dr. Shahab and making him a sort of part of their rallying cry and focusing on him rather than elected officials, do you feel like it's the color of Dr. Shahab's skin that is making him a target?
I'll maybe comment. Dr. Shahab, you can choose if you'd like to comment or not to that question. We had heard some comments earlier at a protest that was in front of the legislature. I had made some comments at those, and I stand by those comments that I made at those days, as I stand by the comments that I made with respect to the protest that we saw this weekend that was moved away from a public institution like the Legislative Assembly, where a respectful protest can occur. With respect to government decisions that are made, and it was moved to a residential neighborhood where a very hardworking and very competent and very appreciated public servant, Dr. Shahab, and his family live. That protest then, as I said, is moving beyond the decision of a government, moving actually to protesting a person. This is unprecedented. I won't say it hasn't happened before, but it's unprecedented activity in this province for people to do this. It's disappointing, most certainly. It's in particularly disappointing when you look at the effort and the effort, the vigor, and the honest way in which Dr. Shahab has approached the Saskatchewan people week in, week out, and has made decisions and made recommendations to this government. And I would just say that, by and large, those recommendations have worked. And notwithstanding a post-holiday bump that we've had and some recent surges in the numbers that we've had over the course of the past month, Saskatchewan's statistics, when you line them up, whether it be on a per capita basis overall, and with our dealing with COVID, have been, very comparable, and some of the more severe statistics, and notwithstanding a very challenging day to day with respect to the fatalities that we have, we're well below the national rate with respect to fatalities, and I would I think we owe a debt of gratitude. We really do, each of us, to Dr. Shahab for the work that he's done, and to his family for allowing him to do that work and allowing him to provide his time to the people of Saskatchewan, and I thank him. I thank him for that.
Follow up?
Yes, from a health perspective, how is it safer for someone to enter a play center with 30 different people opposed to having a small bubble between 1 and 2 families?
Yeah, so I think, we have gone over this with our Reopen Saskatchewan team, business response team, with medical health officers who see transmission both in restaurants and household settings. And I'll just go the dynamics again. So, up till December 14th, you could meet up to 3 households, and even then we saw over Thanksgiving and over Halloween some increase in transmission because people are meeting multiple, they were having multiple gatherings of up to 15 people. So that was driving numbers up. And even if 4 people not from the same household go to a restaurant, it's not zero risk, but it's not high risk if you follow the guideline. It's moderate risk. You shouldn't obviously go if you're symptomatic. You go with your mask on. You sit at a table of 4. You chat with your mask on. When your meal or drink comes, you have your meal and drink. You can linger with your mask on. You're there maybe an hour, hour and a half. Put your mask on and you leave. It's moderate risk. Everyone should make their own decisions. If you are maybe older or have underlying risk factors, you may be safer ordering takeout. I think we all need to shield ourselves if we have, based on age and risk factors till we get vaccinated. But, some people can choose to have this moderate risk. But certainly if the same 4 people get together at someone's house, in a living room or a basement, you linger for many hours and, it's not structured in a way that you can minimize transmission. And that's what we've seen, even, well-intentioned gatherings, even small numbers, the transmission risk is higher with the same number of people in households. Having said that, obviously, if our numbers go down, I think we do want to go back to being able to meet with 1 or 2 consistent households, keeping a small bubble. So I think that's where we are right now. But obviously, we constantly look at transmission. And even in bars and restaurants, with the bars with many outbreaks, half the people were doing everything right, registering on entry, keeping the mask on, sitting at tables, having a meal or a drink, leaving after 1 hour. And if everyone is doing that, everyone is safer. Transmission may still happen really on that table, likely not to another table 3 meters away. But when a few people are not doing that, and they're lurching from table to table, even the people who are doing everything right get exposed. And of course, people who are mingling in this very critical time, they infect other tables, each other, staff, and it becomes a large outbreak. And then that snowballs. That impacts many workplaces. We've had bars from which outbreaks have spilled into daycare, schools, other workplaces, and it goes on and on. It leads to hundreds of cases. And this really is something that really sets us all back. If we want to relax guidelines, a few events can set us all back by weeks. So really, I think it's up to all of us as customers and as business owners to comply, and the vast majority are complying. But the evidence is very clear about where transmission happens and where it doesn't happen. And same with worship places. We've come down to 30. Most places complying. Many people participate virtually. Don't go if they're unwell. Don't go if they feel they're older or have risk factors. People who go, wear a mask. Don't go if you're unwell. Maintain your distance. But in a few settings, maybe at a funeral or a worship service, masks are not worn. People get closer together to mingle. And, our infectivity rate is such that, on any given time, 1 or 2 people out of 100 may be sharing COVID, even unknowingly, even if they're not unwell. So if you have 3 gatherings of 30 with people not complying with the guidelines, at least 1 will result in transmission. If you have 3 gatherings up to 30, like place of worship or funeral without food and drink, everyone complying, chances are none of them will see transmission.
We'll take our next question in the room. Adam?
Dr. Shahab, we've seen our numbers kind of drop a little bit, but we're still higher than you'd like. What's keeping the numbers higher? Are there any areas, populations, age groups that you're concerned about where it's spreading? And what impact does testing have on where we're seeing numbers? Because we've had numbers going up and down as far as total testing.
Yeah, so I do show that as a slide set, and I can certainly show that again. But if you look at our daily new case rates, we've come down to 20. And overall, it's really low in the south and rural parts of the province, a bit high in the southeast. Regina's coming down to around 15. Saskatoon seems to be around 18, and a few outbreaks have really pushed Saskatoon rates up and workplaces. The north, it's small populations. So in the north, generally, people are compliant, people are being very careful, but you get a few outbreaks, in a few households, larger households, that can raise the transmission rate up. Funerals continue to be an issue in the north, and the fact that sometimes it's very difficult to isolate safely in a household if you can't have your own room and washroom. So that's where I think our partners in the SHA and other partners in social service have been working very hard to support people to isolate safely outside the home. Testing rates remain great throughout. They're all green, a bit of a dip. And that's the other thing, that the test rates have come down a bit in the southwest and south central. So that's the other thing. When cases come down, you shouldn't be complacent. We still have to observe these practices, still seek testing whenever we have any concerns or any symptoms, because that's the best way to keep our case numbers low.
Follow-up?
A lot of the provinces are addressing variants, and or have we seen it in Saskatchewan? How are we determining if it's here? And I think that goes back to the earlier question about travel.
Yeah.
If we do see variants, the presence of variants in Saskatchewan, what would that cause you to do? Any more restrictions? Because I guess the word is that they're a bit more easily transmissible.
Yeah. So obviously, any infection causes variations or variants over time, and that's been tracked throughout the pandemic. Obviously, some variants are of more concern, like there's some variants that have emerged in the UK, some in South Africa, some in Brazil, that seem to suggest that they may be more transmissible. So it is obviously a concern that's being tracked closely internationally and nationally, and in Saskatchewan. In Saskatchewan, sampling is done where, obviously, if you have any history of travel or you've been in contact with someone who has traveled, your sample is sent for testing to see if it's a strain that's commonly transmitting or it's a variant. And there's some sampling done by age groups and geography as well. And while we recommend that there should be no international travel, I think unfortunately some people have to travel because they may have a medical emergency in a family member and they may have to travel. But generally, travel rates are down internationally, but I think we do need to keep them down over the next 2-3 months till our vaccine uptake comes up, especially in those in highest risk. Many provinces are seeing variants. I think BC, Alberta, Ontario. I would not be surprised if we saw a variant in Saskatchewan. But again, what we are doing will remain exactly the same. We really have to follow all these public health measures to keep transmission rates down, and these measures work against the variant and they work against the current strains.
We'll take our next question on the line. Operator?
We have Lara Fominov with 650 CQM.
Hi, Dr. Shahab and Premier Wells. The names of 3 businesses, 2 in Saskatoon and 1 in Regina, that received $14,000 fines were released to the public earlier today. I'd just like to ask, what has changed in the last week to allow for this, and will you continue to do this?
I would just quickly say that, we should be releasing the names of organizations that have received fines like this, and we are releasing those now. It's our hope that we wouldn't have to release any more, as compliance is always the effort. But I had said, over the course of the last few weeks, that we are going to be, and I was encouraging all of those involved to increase the enforcement. We don't require additional measures in this province. What we require and what we ask is that everyone follows the existing measures. They work. They proved to work before Christmas. They've been working since Christmas, and we are seeing our numbers start to drop here now. So enforcement is going to continue. Releasing the names of the businesses like we did here today is going to continue. And I would ask those businesses, as well as those patrons that are visiting businesses, to familiarize yourself with the public health guidelines and laws that are in place and follow them.
Follow-up?
Yes. Yesterday, BC, Dr. Bonnie Henry mentioned that out of 100 and some odd thousand vaccines that were delivered, there were a few, 56, I guess, adverse reactions or adverse events. I was wondering, with the 34,000 plus vaccinations that have been delivered in Saskatchewan, have there so far been any adverse reactions to either of the vaccines? And if so, what were they?
Yeah, thanks. So that's really a very important question. So, as with all vaccines, we expect some adverse events, and we watch for adverse events with any vaccine, whether it's influenza or any other vaccine, and we investigate that and we report that nationally, and adverse events are reported nationally now, so we get daily updates, and as of today, I don't have the exact numbers, but they've been around, I would say 10, 15, around that number of allergic reactions. We've had some tingling on the face. We've had one anaphylaxis that was managed safely. So many of the adverse events have been well described in the clinical trials, in the product monograph. They have been managed, because after vaccination you wait 15 minutes. If you have a history of allergies but don't have a history of anaphylactic reaction to the contents of the vaccine, you may be asked to wait 30 minutes. And most of them have presented in individuals who may have had a history of allergies, and they have been managed well. So at this point, the signal is not of any concern compared to what is known about these vaccines, what we were expecting, or what's known about other vaccines. But again, this is something that I think we should watch for in terms of waiting 15 minutes. If you have any allergies, letting staff who are immunizing know. And we'll continue to monitor. I think as we give more and more vaccine, we'll keep comparing our rates with both Moderna and Pfizer in Saskatchewan with other provinces and internationally. But certainly, the adverse events so far have been expected. And of course, the risk-benefit, actually there's no comparison to the benefit of vaccination versus, the risk of, in many cases, reversible mild adverse events, with the only caveat that if you have a known anaphylactic allergy to any content of the vaccine, or if you have an anaphylactic reaction to the first dose, then, we would refer you for further assessment to an allergist who would then advise if, you can get a second dose.
We'll take our next question in the room. Steph?
This is a follow-up to Murray's question. Mr. Premier, I just want to be clear. Is your government considering any kind of legislation or amendments to existing legislation to make it kind of explicitly illegal for people to protest a public servant's home like Dr. Shahab, whether directly or within some kind of a 50-meter vicinity? Is that something your government's considering?
I wouldn't say that we're considering introducing legislation or something of that nature, but we are looking at what would be possible.
Follow-up?
What at this point can you say about what would be possible? Like, what are some of the options you're looking at?
We don't have those options ascertained, as it's just occurred this past weekend. But we are looking at what levers government would have, so that at some date in the future we could potentially consider those options. Listen, it's very disturbing to me, and I think it is, in fairness to a number of people in the province, when you see what's happening, not just here, what occurred here this past weekend, but when you look a little more broadly at when some protests are going beyond protesting the decisions that are made by government. Look to the south of us and what happened in Capitol Hill here not too long ago, where a protest went from being a protest, being a respectful protest, to being something quite different from that. What we saw was this weekend was where a group of people took a protest, they crossed the line. They took a protest away from being about the government's decision, and they took it to a residential neighborhood, to a family, and to the people in that residential neighborhood. So that is a line that has been crossed. It's a bridge too far for me personally. I don't know what levers government has to infringe on, or to even address that line that has been crossed. But we are looking if there are tools to do so, understanding that these are public places as well. Streets are public places, understanding that there is a need to have an area, to have a respectful protest outside of a government institution like this. But there are, in saying that, and I would say maybe this is the stage that we're at, is we have been starting to look at what other jurisdictions have in place with respect to some of the laws that they have, and looking at whether or not we should consider those here.
We'll take our next question on the line. Operator?
We have Kelly Kreiderman with Globe and Mail.
Hi there. Thank you for taking my question. I just want to be clear from the Premier's remarks that you're saying that it's unclear whether the legal threshold has been crossed where some of these protesters could be charged from the incident on Saturday. I'm also wondering, just to follow up on another question, whether there is any sign that the protests and the previous protests in front of the legislature, as I understand it, are motivated by racism. We've seen other chief medical officers of health who are women be particularly targeted in Canada and the United States. And I'm wondering if there is any indication that Dr. Shahab is being targeted for who he is.
I don't know that outside of some comments that were made a number of weeks ago now that I had addressed at that point in time. So I'm not aware of your second question with respect to being racially motivated. The first question with respect to the legal threshold, that also is a question likely best placed to, at this point, the RPS, as I understand there is an ongoing investigation.
Follow up?
I guess I'm just wondering if you can tell us about any of the security follow-up to make sure that this doesn't happen again, even without any charges or legal changes.
There's been security offered to Dr. Shahab by the government of Saskatchewan to absolutely ensure not only his safety and that of his family, but to ensure that he's also able to continue to do his work in an effective manner as he has over the course of his career. As usual, we don't discuss what those security options are, but the government of Saskatchewan will be providing as much security as necessary to ensure that Dr. Shahab and his family are not only safe, but are comfortable.
We'll take another question from the phone line. Operator?
We have Phil Tank with the Star Phoenix.
Yes, we've spoken a lot about Dr. Shahab. I have a question for him. As how is he personally affected by the protest outside his home, and does he feel that it has affected his ability to do his job or his focus? Has that distracted from what he's doing?
Well, I can give a slightly philosophical answer first, or a personal answer first, and then a slightly philosophical answer afterwards. But at a personal level, obviously, I'm grateful to the Regina Police Service, and I feel sorry for my good neighbors who didn't deserve to be harassed like this, and also for my family who doesn't deserve to see and hear these kind of comments. At a personal level, I was made aware that there's a protest. I was working. Saturday, Sundays are working days like any other day. I kept doing my work, and I couldn't clear my snow for about 3 hours, and then went out and did my snow clearing afterwards when it was minus 30 instead of minus 20. So that's a personal thing. But I think, obviously, like the Premier said, protests outside the legislature, yeah, if that's what you want to do, instead of having a policy debate, instead of writing out your question in a coherent manner, that's your choice. The philosophical level is that, like the Premier said, I think, in a democracy, you expect vigorous debate over every policy. Right now we're in a pandemic. It's a long year, and it's creating pressures for everyone. But even outside of pandemic, in democracies, you debate vigorously anything, and you express your opinions through many channels that are available in democracy. But you're also above the law. And in my view, there is precedence that you cannot picket outside any residence. And that is outside of any legal process. You can be in a public thoroughfare or in a public space, but not in front of a residence. And the other thing I'll make, and this is not just reflected to me, but I think no one should be targeted because of race, religious beliefs, gender, sexual orientation. And I think successful countries, successful societies are inclusive and do well. And societies that spiral into hate and division, and you can slice it as closely as you want. When you want to find differences, you can go beyond race and find differences when no one else would notice a difference. And we've seen that in many parts of the world, Europe, Africa. So again, I think the response to this protest by the vast majority of the public was more eloquent than I can ever be, and it gives wind, to my sails certainly. And that is what Saskatchewan is all about, and what Canada is all about. But I think there's a small minority, and I think, unfortunately, social media, while it's great, the internet is great, to remain connected, but the social media also creates its own toxic echo chambers, and it does, unfortunately, perpetuate hate, and I would say radicalize those who are susceptible to hate.
Follow up?
Yeah, I'd like to ask about the 3-week extension. It's longer than we've seen before in terms of extending. I believe the last one was 2 weeks. I'm just wondering why you chose 3 weeks to extend the measures, given that we can see cases seem to be, declining and the situation seems to be changing. So I'm just wondering why you chose 3 weeks.
I would just say part of the discussion that we had was with respect to, there are a couple holidays coming up throughout February. I believe Valentine's Day and then Family Day a little later in February. We did see a post-holiday bump in our numbers after Christmas, after the Christmas season, and we're hopeful by extending this 3 weeks. Part of the reason, and Dr. Shahab will speak to other reasons, is that we're able to get through both of those holidays without experiencing another bump like we did after Christmas. So that's part of the reason for the 3 weeks. Dr. Shahab, you might speak to a little bit more in detail as to why we went 3 rather than 2 or 4.
Yeah, so when we over the summer we were quite comfortable, even going 3 to 4 weeks as we were reopening. Over November we had to move very quickly, like we were updating our orders every 2 to 3 weeks because we had to move quickly because cases were going up. And we were really looking at opportunities to relaxing some of the measures, which already are not as tight as many other provinces have. We're looking at some opportunities, but unfortunately we are not there yet. And we could have said 2 weeks, status quo for 2 weeks. Many provinces have done that, status quo for 2 weeks, 4 weeks. Like the Premier said, 3 weeks seems a nice time because we have school break, a bit of a respite for schools and families over February. And once we come to the end of that, I think we'll be in a better position to see case numbers. And we're all tired of COVID, but we have to stay the course. March, days are longer. April, spring is here. We really have to hold the course for the next, I would say, 6 weeks, and then, more and more vulnerable people are going to get vaccinated. Spring, summer, we can be outdoors more, even though people had a great time enjoying the outdoors the last 6 weeks. It's been a bit colder this week. And I think if we can stay the course in that way and just be cautious and careful with some of these fairly simple measures that all of us have now really embraced and know well, I think that if we can that can tide us over with hopefully a decreasing trend in case numbers, then we will review mid-February. We probably have another 4 to 6 weeks to go, and then once we start entering April, hopefully we should be starting to carefully come out of this. But I think we do need to stay the course.
We'll take our final question on the line, operator.
We have Greg Wilson with Radio Canada.
Hello. I was wondering, you said earlier today during the presser that we're virtually dry, virtually empty of vaccines. I wanted to know how many vaccines do we currently have in the province as we've continued to provide doses today and yesterday?
Scott or Doctor, if you want to speak a little bit to that, I would just maybe start by with a note of appreciation to all of those frontline staff, of all of those frontline healthcare workers that are delivering the vaccines. We were asked questions here a few weeks ago and I was asked the question whether I have the confidence that our public health system was going to be able to ramp up and to deliver the vaccines in this province. And I had indicated at that point in time that I most certainly did have confidence in the Saskatchewan Health Authority and those frontline healthcare workers that I knew delivered our flu vaccine program each and every year. And you're seeing the results of their efforts here today, and I thank them for these efforts. Scott, you might speak in a moment to how many actual vaccines we may have left in communities, but we've received here in the province 32,725 doses, as you can see online, and delivered over 100% of those doses, 34,080 doses, and that is only possible by not only our frontline healthcare workers being very capable at what they do in delivering those vaccines, but being very competent and ensuring that there is no vaccine volume that goes to waste as they are utilizing everything that we are provided, ensuring it's in the people of this province's arms. We're at over 104% of the vaccines that we have provided have been delivered. And I just say a huge thank you to each and every person that has been out there doing what they do best. Scott, do you want to speak, or if you have the numbers as to do we still actually have some vaccines in various communities?
Sure, Premier. I don't have the exact numbers, but I can speak to it. So on the Pfizer side, we have a very small amount of vaccine left in Saskatoon, but that's already for booked second dose appointments associated with that very initial vaccination before we started going single dose. And then for the Moderna vaccine, there are 2 communities in the province that still have a small amount of vaccine left. It's under 1,000 doses in the far north, as well as in the southeast, associated with some of the high vulnerable communities. But those doses will disappear over the next couple of days as those vaccinations are completed.
And I would just add in closing to that, we're expecting about 12,000 vaccines next week. I'm confident that we'll be able to get those out in very short order upon their arrival. We've been very vocal about we need more vaccines and we need them sooner rather than later. But we'll start with those 12,000 here next week. And there's going to be a lot happen. Dr. Shahab and I were discussing this earlier. Going to be a lot happen in the next 3 to 6 weeks as our vaccination numbers should increase. And we've been assured, most recently on our First Minister's call last week, that we still are going to get our allocation of vaccines that we were allocated in the first quarter of this year. We're hopeful that the AstraZeneca and Johnson & Johnson vaccines may be approved at some point, and we may be able to procure some of those vaccines, which would be very helpful in getting us an even larger number of vaccines early, as soon as possible. But you're going to see in the next 3 to 6 weeks significant numbers of vaccines arrive, and that's our hope, and that's what we've been told. And you're going to see those arrive in our communities across this province. And I think that's a number that we want to watch, is the percentage of people and high-risk people that we are able to access with these vaccines in the next number of weeks. And the other number that I know we'll all be watching as we vaccinate those that are at highest risk in our communities, and your age is your risk factor. That has been very evident across the nation and around the world. But we'd be hopeful that as we vaccinate those that are at highest risk, that our hospitalizations start to decrease. And when that occurs, it would be the opportunity for Dr. Shahab and I to be out here having a very different conversation.
Follow up?
Nope, that was very clear. Thank you very much.
That concludes today's update. Thank you all for joining us.